Hi, Eric Lanask here. We are in San Jose, California for WebRTC Conference and Expo 5. Joining me today is Pete Kilcommons from Medweb. Pete, thanks for joining me.
Thank you very much. I'm happy to be here.
So you were telling me you recently ended up your tenure on the board of directors of the American Telemedicine Association.
That's right. I was very fortunate to be a member of that organization, which is all about virtual care and telemedicine globally, as well as here in the United States.
Why is there so much, having gone through that now and being obviously very, very close to that, why is there so much interest in telemedicine?
Well, what's happening around the world is that the number of physicians available to provide medical service is decreasing relative to the proportion of the population. And so whole nations are anticipating major crises if they can't come up with a more efficient way to make use of physicians' time and healthcare experts' time.
So there's an obvious need there for technology-based healthcare, and certainly WebRTC, one of the major vertical markets that people have talked about pretty much from the get-go. Once standardization started to happen, was healthcare. What are we seeing, and in particular, what's Medweb doing in the space regarding WebRTC?
Well, thanks for asking. The main thing that we see is that the government. In the United States, we have 23 states right now and rapidly expanding states that provide us with something called parity payment, which means that you can see your physician over the web or you can see your physician in person, and the insurance reimbursements are the same. And private healthcare providers, our insurance providers, are equaling that government initiative. And so that radically changes the accessibility and ease of use for the patient. If you have like a 1-year-old and you're trying to decide whether to go to the emergency room or not, one application of our technology is allowing people to just pick up their smartphone, initiate a virtual visit via WebRTC, and link into a care provider at their hospital or their physician service group, and decide whether they need, go, no-go. Should I go to the emergency room, or is this something I can handle at home? And it turns out that a substantial portion, perhaps 80% of those emergency room visits could be eliminated by getting that the expert medical advice that the person needs to deal with whatever the particular issue is. What Medweb has done, Medweb's been in the medical imaging and informatics and telemedicine field for over 22 years now, and we provide this in a variety of different environments around the world, not just here in the United States, but in really austere environments and in countries in the developing world. And so we've built infrastructures that tie into a lot of the medical standards that are also a considerable challenge, because healthcare has its own world of libraries and communications protocols for information systems to communicate. So hospitals that are on electronic medical records, for example, some of the larger chains, they're using Epic. We have 50% or so, some odd, of the hospitals in our country right now are using one particular vendor, and that vendor has its own ways of communicating, tracking appointments, and so on. And Medweb has expertise in integrating with Epic and all the other electronic medical record system vendors, as well as picture archiving and communication systems vendors, pulling all that information in and providing a WebRTC gateway that allows the hospital to very cost-effectively apply the medical expertise and that they do have in their clinics and in the hospital and the emergency room so that it can be used for virtual visits. We see Medweb also being used for clinics in, for example, pharmacies, where you can have a nurse or a nurse practitioner participate in person with the patient and then link back to a medical professional. Again, providing tremendous ease of access for the patients, where they can walk into their pharmacy and do a medical visit, and at the same time, much more efficient use of the physician's time, so everybody wins.
So it because of the nature of the healthcare space, and certainly it the fact that it's just a heavily regulated industry is one thing, but the fact that there's, you mentioned some healthcare specific standards, it really does require somebody with an insight into and experience in the healthcare space in order to be able to accommodate more than just providing the WebRTC interface.
That's right. It's all about the enterprise and being able to integrate into the existing information systems in a in a seamless manner. And then, as you mentioned, regulatory. As a medical device manufacturer, we're regulated by the FDA, and we have to follow good manufacturing practice in how we develop our apps and our various tools. And the other part of this that's very interesting is we always talk about wearables right now as a very hot buzzword. And so Medweb also provides a gateway to collect information from wearables. So we connect to HealthKit on iOS and to Google Fit on Google and Android devices. And we provide a gateway that's intelligent enough to figure out when there are substantial events that would be of interest to the medical care provider, because medical care providers don't have the time to receive all of the data that's coming out of your wearable device 24/7.
Right. Well, I guess in that case, it's a question of setting up alarms and alerts like we do for all kinds of different activities within our lives.
A little bit trickier than that. We talk about contextual information systems. And so what Medweb is doing is actually analyzing the data using automated algorithms. So we're looking at the EKG data and deciding when some change in the EKG is sufficiently interesting or concerning that it needs to be passed on to a physician or a nurse to analyze the data. And of course, we can take it to more extreme levels in terms of determining if somebody is experiencing a cardiac event that would require an emergency visit.
Does this, the idea of WebRTC telemedicine, does it change the way that doctors and healthcare providers in general are behaving with their clients? Certainly, it gives access via different means to individuals, but does it require more attentiveness within the healthcare facilities to make sure that providers are available if I'm calling instead of, as you mentioned, perhaps going directly to the emergency room?
Well, it's a very good question, and it makes a huge difference in the way providers relate to their patients, but also the perception from the patients and what impact it has on their lives. To give you an example, we have a teledermatology application that is very, very popular, runs on mobile, and allows any clinician or healthcare provider to just pick up their phone, take a couple of snaps, and send it off to a dermatologist. Right now, if you want to schedule an appointment with a dermatologist through your healthcare plan or your service, it might take you weeks. However, there are certain dermatology illnesses, for example, melanoma is a type of cancer, which can kill you in 6 to 8 weeks. Not necessarily kill you, but reach a stage where it's intractable. Mm-hmm. And so the ability to just snap a picture and get a response back from a dermatologist in mere minutes radically changes the landscape for clinicians, for payers, and most importantly for patients.
One of the interesting things about the healthcare space in particular when it comes to WebRTC and some of the features and capabilities that you've talked about is, the conversation often starts around with technology around cost savings. A lot of the WebRTC conversation is about business efficiencies and just how to make those business processes easier. In this case, there's really a very tangible health benefit that can be achieved, both for the end user as well as for the physician.
That's right. And that health benefit is dramatic because it's all about access to care. And again, with the shortage of physicians, the declining budgets for medical care relative to the size of the population, WebRTC provides a very tangible and successful application or suite of applications that can be used to radically improve healthcare. The trick is to combine that with, again, those HL7 and DICOM and integrate healthcare enterprise stuff, making sure the application is HIPAA compliant, which is a privacy law that we all have to follow. And then the third thing is, of course, is in terms of regulatory requirements for medical devices. As we're connecting, WebRTC turns out to be a wonderful avenue for the Internet of Things side. And so we do a lot of medical device integration where we're streaming data, we're pushing data for analysis, and we're capturing data from even the most mundane consumer personal appliances and looking at ways that we can provide that user with better feedback on their own health and progress towards better health.
Excellent. Sounds absolutely fascinating. Pete, thanks so much for joining me here, and thanks for being at the show.
Thank you so much.